So, good morning, everybody. And sadly, I have to report 3 more Albany County residents passed away to COVID-19, bringing our total up to 191. It was one woman in her 50s, one woman in her 70s, and one woman in her 90s. To the 3 families, my condolences, my prayers go out to you in these difficult times. To the other 188 families, this is hard enough what we're going through, this new world that we're in, and hopefully going to get out of soon. My heart goes out to you. It's tough, and the fact that we're seeing more people in their 50s now being affected by this, it's getting scary. It's been scary, but it's getting scarier when you start seeing people younger and younger that are falling to this awful COVID-19. So please, people, take the time to reflect on everything around you in your new world, but take the time to think of these families that lost someone, and even people that lost someone that didn't have COVID-19. It's a tough time to say goodbye to people, especially when you lose your mom, your dad, or somebody, and you couldn't have a proper service or send-off to celebrate their life. So please keep these 3 families in your prayers today. As of today, there's now 8,912 cases of COVID-19 in Albany County to date. We have 178 positive cases today. Yesterday, we all know, was at 222 or 220, and the day before was 222 before that. This number is lower than what we've been seeing over the last 3 days, which is likely because some of our testing sites were closed on Thursday due to the snowstorm. There are currently 3,063 people under mandatory quarantine. Of the new positive cases, 22 have close contact to a positive case. 5 are healthcare workers or residents of a group setting. 151 don't have a clear source of infection at this time. And again, I said this yesterday, Dr. Whalen and our team are dealing with some very high numbers, and it's going to take time. But, please, just understand that at this point in time. Over the last 5 days, the new average is 200.6 new positive cases each day. The day before that was 195.8. As of today, 30,824 people have now completed quarantine. 7,293 tested positive for the virus and have recovered. We have an increase of 183 recoveries since yesterday, which is good. There were 9 new hospitalizations overnight. We continue to set records in terms of our hospitalization numbers, and that's pretty much why I'm here today, because of 3 people that passed away and our hospitalization numbers, even though, and I think Dr. Whalen and I have said this, that everyone's starting to get numb to the higher numbers. There are now 113 people currently hospitalized from the virus. This is the highest we've ever had. Yesterday we're at 104, today we're at 113. So this number has been increased since December 13th, where we're just at 80 people hospitalized on the 13th of December. So now we're starting to see what the rest of the state and this nation's looking at. We're starting to see more people in the ICU, more people in the hospital, and it's alarming. 22 patients are now currently in our ICU. Yesterday it was 21. The day before that it was 18. Once again, this is the highest we've seen to date. Just yesterday we had set the previous record. So that's the stuff on the new matrix that the governor or DOH has been looking at. Our hospitalization capacity, our ICU beds, staffing, and so forth. And as that number goes up, then we have to be more alarmed of what's going on and get ready. Dr. Venditti, who we had on last week, is going to be on our control room this Tuesday at 1400 to talk about the plans that they're having every day as they talk to not just all the hospitals in their partnership, but all the other hospitals in the Capital District, to really talk about how they plan to attack this if these numbers continue to go in this direction. So we'll wait to see what their plan is, but I know that Albany Med's been leading this and having conversations every day of if they get too many people in, what patients they can ship to other hospitals, to obviously to make sure that we have enough ICU beds, and to make sure that there's enough beds in general for not just COVID-19, but for the daily operations of every hospital in the capital region. So again, be patient, look around us. You see the surge in El Paso, Texas, and Wisconsin, North Dakota. It's alarming, to watch what's going on in these hospitals. In California, just put an order in place that an ambulance can't be turned away if someone comes to their hospital, and they literally have lines of ambulances because they don't have the bed or the capacity to take care of the surge that they're having. So to Dr. Venditti and his team, and to making sure that this doesn't happen, thank you for that. So one of the things, like I said, we're seeing our hospital bed space going down to 25%, and our ICU beds going down to 35%. We continue to urge people to wear a mask, socially distance, cough into your elbow, clean your hands, and stay 6 feet apart, please. This is more crucial now than ever, especially with Christmas upon us, and more people, unfortunately, going out and about. And I'm pleading with the residents of Albany County, please limit your time going out. I know you want to get out there. I know you want to just get fresh air, or you want to socialize. We're close, but we got a couple more months ahead of us, and this next month is going to be so hard. This month of December, what Dr. Whalen and I have been saying, has been a difficult month for all of us. And I believe going to the first of the year, it's going to be even harder, and you're going to see higher numbers, because the vaccine's out and the state has an extra 350 vials coming in, doesn't mean it's going to get out to everyone in the next week or two. It's going to be months before some people are offered shots. Again, I addressed yesterday with our nursing home. We know our residents are getting it, but the workers aren't. These are one of the things we have to be careful of in monitoring. I've talked to doctors that basically work in their private offices, and they're asking when they are going to get the shots, because they're seeing patients. It's essential. They're essential employees, but they're not even that category. So it's something we're going to continue to monitor, to look at, and make sure that we try addressing. I had a great conversation with Wanda Willingham yesterday with the Black Caucus about how we're going to try to find out people that don't have doctors, that have underlying health issues, that we can address all this stuff. So it's going to be tough as we go forward. Please hang in there. We're going to get through this, and we're going to continue to move forward. But please, I'm urging people to continue to get tested, whether you have signs or symptoms. Get there, get tested, and just remember, just because you're positive doesn't mean you're not going to, or negative doesn't mean you're not going to be positive 4 days from there. You got to be careful of that too. At that point in time, you're negative. 5 days later, it could be different, and that's why I brought up Jenny yesterday, who quarantined for 14 days and didn't feel good, and got another test, and she was positive. So it happens. One of the things I'm going to talk about is the regional hubs and how that's going to work, and I'm going to have Dr. Whalen talk about that, because her and her team, and I want to say this, I'll say nicely, 50 years, have been putting in a plan of actions with the medical corps and everyone else, how to distribute things like this, like a vaccine or other emergencies that you plan for. And we submitted our plan not just to the federal government, to the state, but this is all new, how they're handling it. And I want to, and I'll say this: we've gotten phone calls from EMS services all over. I know Dr. Daly's been on this, but again, you got to be patient. As we get the information and how they're changing this or telling us how this is going to be done. Yes, Dr. Whalen had a plan that not just the plan she submitted, but the one they've worked on for years and practice on. But Dr. Whalen can speak about that. Dr. Whalen.
Thank you. Before I speak about the vaccine hubs, I want to just talk a little bit about some of the questions that we're getting at the health department, in particular, questions we're getting around retesting. So our case investigators are working very closely on positive cases that come in to ensure that we can do the investigation and contact tracing, refer to the state for contact tracing as needed. We are getting questions, though, about employers who are asking for negative tests after someone has been out with a COVID diagnosis. And I just want to let people know that it is very common that people will persistently test positive with the PCR test even after they've recovered from COVID. So we don't recommend that employers mandate a negative test before someone comes back. The reason people can test positive is that the test is reactive to a genetic component, and it does not tell us whether this is alive or dead. But studies have shown, so it's not transmissible, in other words. Studies have shown that those that have COVID-19 are infectious generally for a period of about 9 to 10 days. And this is the period of isolation that we recommend for people. If they remain fever-free, if their symptoms are improving, unless they are severely ill, they are usually cleared from the health department to go back, whether it is to a work environment or to a non-isolated home environment. So this is something we want to share with people. There's one exception to that. If you work in a nursing home, you have a different protocol. But for the general public, we don't generally recommend a negative test to go back to work. We're continuing to see our numbers climb, and again, I think it's essential to continue the message that what you do today is going to influence what happens over the holidays. We don't want to have an additional surge upon the surge that we're currently having. It is very frightening to see what's happening in Southern California with the capacity of hospital beds rapidly dwindling and the lines of emergency vehicles with patients inside waiting to get into hospitals. This is something we can avoid, but it is down to you. It is down to each and every one of you and the behavior that you choose to do in the next coming days and weeks. The most important thing you can do, again, is to wear your mask. Wear your mask when you go outside your house, and avoid large crowds and large gatherings. This is essential at this point to curbing the spread in our area and preventing scenes like we're seeing in Southern California from happening in Albany. So please remember to do these very important things. And again, it's not our pleasure to talk about rearranging Christmas plans. Personally, I know it's a sacrifice that we'll be making, and I encourage you all to consider how you can avoid large gatherings, including family gatherings, which have been shown to be an important genesis of spread. So the simple question you ask yourself is, am I inviting someone in that doesn't live in my family home? And if the answer to that is yes, you are taking a risk, and your risk is of spreading. So please consider this very carefully going forward into the holiday plans. So we are very heartened to see that there is now availability of Pfizer vaccine for our frontline healthcare workers. And we know that these vaccinations have started in Albany County, and in particular at Albany Medical Center among frontline workers. This is a great development, and this is really the beginning of the end as we start to work towards getting vaccine spread throughout our highest risk workers, our highest risk residents in nursing homes, and those that care for individuals in nursing homes, and how we march that out to the larger population in the coming weeks and months. We learned this week that the governor has allocated 10 regional hubs across the state to coordinate and distribute vaccine. And we are still learning what that means. We had the local health departments were invited yesterday to convene with Albany Medical Center's lead on this to start the conversation planning. And we know that there is a lot of work to be done and that this will involve a lot of communication and partnership. As the county executive indicated, we have been planning at the county health department to do vaccination for the county for many years. We've developed a robust medical reserve corps of including nurses and doctors that would be at the helm and ready to vaccinate should they be needed. So it really is going to be, I believe, a coordination of the existing plans that we have in place along with the organization that the regional hubs will provide. The regional hub at Albany Medical Center is responsible for an 8-county region, which corresponds to the region of economic developments across the state. And those were the representatives, whether they were the health department commissioners or directors, that were on a call yesterday. The regional hub has convened a task force which will meet on Tuesday, which I'm also pleased to be part of. And I know that we will continue our close communication with Albany Med about plans as they develop and roll out. And as we know more, we will share it with you. We appreciate that there is a need for transparency and accountability, and most of all, an equitable plan for distribution of vaccine across Albany County. And we will be working with other community leaders, community-based organizations, government officials, and others to ensure that we work together to make this plan a reality. So as we learn more about that, we will share it with you. I'm pleased that the effort has started out already with this communication, and look forward to sharing more information with you as I know more.
Thank you, Liza, and thank you for that insight on the regional hubs. Like I said, it's new that we're dealing with this regional hubs theory. And again, we have health commissioner and we have Department of Health that have practiced this for many, many years and know what we need to do in the community. And hopefully they continue to listen to your leadership and our plans that we have. So I also want to remind people, with Christmas coming up on Friday, some of the scheduling is going to be different for testing this week, obviously. So our testing at the Times Union Center is going to be Monday and Thursday next week. Whitney Young will still be in Watervliet, but the Watervliet Administration Building. So please call Whitney Young if you don't have insurance. Call them just to get tested in general. We'll pay for it if you don't have insurance. But call them also about the times, or you can go on our website at albanycounty.com and look at the times and numbers of places. But Whitney Young is 518-465-4771. We'll cover the cost as always. UAlbany's completely free, set up by the governor and across the state. 188-364-3065. Price Chopper CVS, our good partnership with Priority One in Gilliland. And again, please go to our website at albanycounty.com, and you can see the full list of availability of times and testings and age requirements if you're looking for children of different ages. Mental health support's always available 7 days a week, 8 a.m. to 5 p.m., 518-269-6634. Our 24-hour sexual assault hotline number, as always, 518-447-7716. And our 211 in our New York State hotline. Also, just want to say to my daughter, Taryn and Ellen, make sure you have your mask on when you're out there sledding today at Albany Muni. And to the radio station that said I had county equipment at my house digging me out, get your facts straight. I'm not even going to call you out because you're not worth it, what station you are, but you know who you are. And I will say this, my neighbor came over, helped me. I got stuck. I was stuck for 45 minutes on my street because once I cleaned out my driveway myself, I got stuck in the middle of the street. So yes, I could bring county equipment into the city of Albany at the request of the mayor. No time would I have a truck from the county come down my street and plow me out. So get your facts straight. Again, please, I know it's a different world. The mental health is available, and please, by all means, call that number. I know people are having a difficult time adjusting to what's around us, and I would suggest that maybe that certain person at that station calls that number and deals with the world around you. So again, stay safe, healthy, wear your mask, stay apart from each other, and we'll get through this. The world's different. It's a marathon, not a sprint.